Hello, my name is Dr. Craig Childress. I'm a clinical psychologist in Pasadena, California, and I specialize in treating children and families around issues of attention deficit hyperactivity disorder, parent-child relationship problems, angry, oppositional, defiant children, marital problems, things like that. Now, in this set of video segments, I'm going to be discussing a particular type of parent-child relationship problem that I refer to as a parental alienation dynamic. Now, in using that phrase, I'm referring to a specific structural family systems process that includes a particular set of DSM-4-TR diagnoses. Back in the 1980s, Richard Gardner proposed the idea of a parental alienation syndrome, and since he first proposed the idea of a separate syndrome, it's generated a considerable amount of controversy. I wish to differentiate what I'm talking about here from what Richard Gardner proposed in terms of a separate syndrome, primarily because I don't think the idea of a separate syndrome is really necessary. As a clinical psychologist and child and family therapist, I'm finding that parental alienation processes are totally understandable within traditional structural family systems conceptualizations, and are also able to be conceptualized through existing DSM-4-TR diagnoses. So I just find that the idea of a separate syndrome is unnecessary. What I'm going to be talking about in this set of videos is both how to understand the idea of a parental alienation process, how to go about diagnosing it, and how to go about treating it. I'm going to start by explaining to the targeted parent why child therapy is particularly unhelpful to them at this point in time. If you're a targeted parent, you know that taking your child to the therapist or doing parent-child relationship therapy has often proven to be particularly unhelpful, and sometimes the therapist may even collude with the alienating parent in contributing to the alienating process. Why is that? That's what I'm going to start by explaining, because if you can understand why it is that many child psychotherapists miss the diagnosis and don't really provide helpful treatment, then you're going to be able to hopefully have a higher level of discussion with these child psychotherapists and alert them to the particularly relevant features that they need to be looking for. I'm also going to describe the diagnostic process, how to go about diagnosing the alienation process. This is particularly relevant regarding court issues. Because if the mental health profession cannot reliably diagnose the alienation process, then this makes it harder for attorneys and the court to decide what to do about it. Now, in this area, as I discuss the issue of diagnosis, I'm going to be directly speaking to other child and family psychotherapists regarding the issues, and so I might use a level of professional dialogue that is more complex. However, again, I think it's important for the targeted parent to understand what the diagnostic issues are, so that as they work with the mental health profession, they're able to engage the therapists in a higher order discussion about what the diagnostic and treatment issues are. And in cases where the therapist may not have recognized the diagnosis, the targeted parent may help to alert them to specific features of the alienation process. And then finally, I'm going to be discussing the issues around treating the parental alienation process. It is one of the most difficult things to treat. As if you're a targeted parent, you understand this. It is really intractable. And I'm going to be discussing why that is, how to understand it, how to work with it. And I'm also going to be discussing for child and family therapists what they can do in order to treat and resolve the alienation dynamic. It's not going to be pretty. It's not going to be nice. It's going to be a very, very, very difficult issue, although it is treatable and it is resolvable in my view. So, welcome. I hope you find this discussion interesting and valuable. And if you are a targeted parent who is listening to this set of videos, you have my sincere sympathies and concern for what you're going through. Welcome.